In this question, you have to identify the hormones that play a significant role in osteoporosis. Option A, aldosterone and prolactin. Now, aldosterone regulates fluid balance, and prolactin is primarily involved in milk production. And these hormones do not have significant effect on osteoporosis. Hence, it is incorrect. Option B, progesterone and aldosterone. Now, aldosterone, as mentioned earlier, regulates fluid balance, and progesterone affects the menstrual cycle and pregnancy, but they do not have a significant influence on osteoporosis. Option C, parathyroid hormone and prolactin. Now, parathyroid hormone can influence bone reabsorption and is linked to osteoporosis. But the primary role of prolactin, as stated earlier, is the production of milk. Hence, this is also incorrect. Option D, estrogen and parathyroid hormone. Now, estrogen promotes the activity of osteoblast and inhibits osteoclast. So, in an aging female, osteoporosis occurs due to deficiency of estrogen because estrogen is essential for maintaining the bone density, and decrease in the estrogen, especially after menopause, is a major risk factor for osteoporosis. And regarding parathormone, it promotes the mobilization of calcium from bone into the blood. Hence, this is also known as hypercalcemic hormone. And excessive activity of parathormone causes demineralization, leading to osteoporosis. So, both these hormones play a significant role in the development and progression of osteoporosis. Hence, it is the correct option.